I'm Mark Mellinger. I'm one of the orthopedic surgeons here at Northern Arizona Orthopedics. I specialize in hand, wrist, and elbow surgery. If somebody stops doing the things that they love to do, if they stop, doing whatever sporting activities they want to do, or their arts and crafts, or whatever kind of activities that make them who they are, that's when it's time to get more aggressive with care and try to get them back to doing the things that they love to do. Surgery is absolutely something you don't take lightly. You try all of the non-operative therapeutic modalities first. When those don't work and we're not satisfied with where we've gotten, surgery is sometimes an option. You can be rest assured that it's a process that has been designed well, has been thought out well, has been done thousands of times that year. And often I'll tell that to the patients. I say, yeah, there are risks with surgery, but by far and away the most risky thing you're going to do that day is get into your car. They usually say something, well, yeah, it's my husband driving, I know that. As a surgeon, the one thing that really stands out is you're able to use your brains, you're using hands at the same time, you're making connection with the patient. You can see them go from a condition that's painful or debilitating, and you see them a couple months later and they're back to doing the things they love. I don't know of too many professions that you can do that really uses every part of the gifts that you've been given. With Northern Arizona Orthopedics, there is a high level of experience in just about every facet of orthopedic care. There really is no substitute for experience. It's really that experience and having enough experienced people in one location that you can basically run things by your partners. In many ways, you don't just get one doctor. You really do get a large team. You get a doctor, you get a physician assistant, you get the physician partners, and it all comes together as a team.